Agitated or violent patient. Differential diagnosis for agitated or violent patient. Differential diagnosis consists of general medical conditions, substance-related causes, and psychiatric diseases. First, we will discuss general medical conditions, endocrinological causes, and renal dysfunction, Cushing syndrome, and renal insufficiency. Cushing syndrome, moon face, buffalo hump, muscle wasting and thin extremities, stretch marks on abdomen, any form of purple striae, weight gain and obesity, easy bruising, skin and bone thinning, decreased libido, menstrual changes, hirsutism. In adrenal insufficiency, there will be hypotension, hypoglycemia, hyponatremia, hyperkalemia. In thyroid disorder, thyroid storm, mixed edema coma, thyroid storm, there will be tachycardia, arrhythmia, for example, atrial fibrillation can also occur, goiter with bruit, diarrhea, heat intolerance, weight loss, still increased appetite. In mixed edema coma, there will be swelling of distal limbs and thinning of proximal limbs, heavy menstruation, bradycardia, cold intolerance, constipation, infectious causes, encephalitis meningitis. In encephalitis meningitis, there will be headache, neck rigidity, projectile vomiting, focal neurological deficit or seizures. Sepsis. In sepsis, there will be elevated temperature, hyperthermia, hypotension, tachycardia. Metabolic causes, electrolyte disorders, hyponatremia, hypercalcemia, acid-base disorders. For acid-base disorders, request ABGs, arterial blood gases. Acid-base disorders usually occur in respiratory diseases or renal diseases. Metabolic causes, hypoglycemia, hyperglycemia. Blood glucose can be checked instantly at bedside. Uremic or hepatic encephalopathy. A uremic encephalopathy occurs in a patient with chronic renal failure. Hepatic encephalopathy occurs in a patient with decompensated chronic liver disease. Wernicke encephalopathy. In Wernicke encephalopathy, there is impaired mental status, ataxia, or abnormal eye and abnormal eye exam. Neurological causes, dementia, intracranial tumor, intracranial hemorrhage, seizure or post-ictal state, stroke, musculitis. For neurological causes, focus neurological examination and request CT or MRI, brain, trauma, head injury, severe pain. Other causes are hypothermia, hyperthermia, hypertensive encephalopathy, hypoxia and or hypercarbia, shock. Substance-related causes are intoxication, CNS stimulants intoxication, CNS depressants intoxication. Substance withdrawal may cause agitation in a patient. Alcohol withdrawal, benzodiazepine withdrawal, opioid withdrawal. Medication-related causes which can cause agitation in a patient or overdose. For example, anticholinergic overdose, adverse drug reaction, for example, steroid-induced psychosis. Psychiatric diseases in which a patient can be agitated or violent are schizophrenia, bipolar disorder, psychotic depression, anxiety disorders, personality disorders, post-traumatic stress disorder. Thank you.